My name is Liz Shiflett, and we are geriatric care managers with Premier Life Care Management. And what we try to do is maintain individuals in their homes as long as possible and to maintain independence. And then when we need to think about relocating or increasing levels of care, we come in and we do a comprehensive assessment, and then we meet with our clients and we form a plan and we talk about options, and then we will make recommendations, and then we kind of go from there. It's a very interactive process and go over the resources that are available in the community, and we kind of go from there. Well, the aging population is such that there's so many things that could happen, and so many things are preventable. Falls, medication errors, running out of financial resources. So we try to catch these things before they happen. So what we like to do is get our eyes in there. We do an assessment in the home, and some of the recommendations that we do is bringing resources in, whether that's home care or physical therapy, meals, cleaning services, things like that. And then once we go from there, then we can do weekly follow-ups, we can do more than that. Basically whatever the person that we're working with needs, we tailor it to them. And then we really focus on communication with our clients and the family members so that we can really know what's going on in the home and catch these things before little problems can become big problems. Powers of attorney are really important to have in place. These people should be somebody that's very familiar with what it is that are the wishes of your loved ones, so that if a crisis is to occur, people are not in a state of, what am I going to do? All of these things have been talked about, and that a plan can be already discussed and in place, and when something does happen, that you have a starting point to go from, it's calm, and that you can just put the things that you've already discussed into place, and it's a smooth transition, and that you can activate resources. We try to prevent hospitalizations. That's our main goal, or one of our main goals. Medications are also another very important aspect of seniors today. There's polypharmacy, where that people are taking so many medications, and you would be surprised that they don't even know what they're taking, what it's for. Sometimes they're taking multiple things for the same thing. One doctor's prescribing something and another doctor has no idea. And the side effects are so great that they can cause problems with appetite, with memory, and oftentimes a lot of what you're trying to treat, a side effect can totally work against what you're trying to do. So we often will try to go through the medication list, figure out what they're for, make sure that you know what it's for, make sure the physicians are all on the same page. We make sure that there's a list in the home. Family members also know what they're taking, make sure that they're taking the right thing for the right diagnoses. So we find that we really have to get a great handle on medications, and then also with that is preventing hospitalizations, so that we get really good outcomes that way. And part of that is regular follow-up with the physicians, where the people go to their doctors if they have some form of any little thing that you might not think could be important. We want to have that constant communication with the provider. Maybe if they're not sure if they're taking a medication, or if they've missed a dose, what do I do? Do I take double? Do I skip it? Do I even have to tell my doctor that? So we want to interact with the physician, let them know what's going on, get that communication in with the physician, get them in with the appointment, see if we need to make some adjustments to the plan of care, so that something that could be that's very minor we can go ahead and fix, so that it doesn't become that somebody forgot to take their medication to prevent edema, which is fluid buildup. If we can get ahead of that, that can prevent them being in the hospital for fluid overload, which is a really big deal these days for some of our clients. So little things like that, little tweaks that we can do. Also preventing pneumonias, things like that. So that's another big piece that we have to do with our clients as well. And the primary care physicians, that's a big push that they're trying to do well. So it's a very collaborative effort, and then also that helps the family members, because then we can help them, because they sometimes don't know the right questions to ask and they're overwhelmed, so we can kind of step in and be that expert to help them navigate the healthcare system.
The aging population is something we all need to recognize. Right now, the largest portion of our population is over 85 and growing. So they're predicting the next 15 years we're going to have an inundation of workers and home care aides, care managers like we are, to go in and work with clients as they age. And it's to prevent rehospitalizations and emergency room visits, as Liz is saying. One of the things also is the incidence of dementia in the community, and that's occurring a lot with the elderly community, but we also see it at a younger age. So it's good that we're educated and certified by the Alzheimer's Foundation of America to deal with the behaviors of dementia. So that's an integral part of what we do as well. And a lot of times in doing an RN assessment, we do see with the clients that there's something memory related, there's a problem. We can ask questions about orientation and memory issues that kind of is a baseline to get them to a physician to see if there is a diagnosis of Alzheimer's. And dementia is the symptom of Alzheimer's. So there's a lot of, it's an evolving field. It's one that we feel that we are contributing to, and we want to grow this field through awareness in the community and also awareness in the healthcare community. Because a lot of people in the healthcare community do not know that we're available, but it's becoming more and more so. So one of the things with the video is in the San Diego community is to know that we are available, we do these services, we provide the RN assessment. And that is the first step a lot of times to not only head off problems, but also to see what other treatments and medications they might need. Well, actually, it is private pay, and in many instances people will ask us, does Medicare, my insurance company, cover this? And the answer is no, not at this point in time. Some long-term care policies will cover this service, but you have to read your provisions in your policy. But normally when people are seeking our services and we go over that it is, the assessment is anywhere from $150 to $450. And it gets more involved sometimes because we have to do cases for court, meaning capacity. Is the person able to make decisions for themselves? But honestly, most people are willing to pay the private rate with no problem. And then our hourly is $100 an hour. We're one of the lower rates, if you will. We've been this way for 7 years on the East Coast, and we brought those rates into the West Coast as well. So in any event, it is something that you can also, it's a service agreement, it's not a contract. So you only pay for the time you want us to do things for the client. This not only will save you money in the long run, but also save you headaches in terms of, oh my goodness, we're going to have a really huge crisis or something we can't handle in a familial way. But it's also redirecting people to also get a plan in place. And a plan is really so essential. It's the foundation of all of our lives in so many aspects, but certainly when you have a medical situation, and certainly when you have an aging population. And that's, how people identify. Now, I'm so glad I found your service.
Yeah.
It's the way, they respond to us. And so we've had some clients for 7 years.
Yeah.
And, and it's amazing that, sometimes we do a lot of long distance caregiving. People live in London, relatives live in London, they live across the country, they live in Texas, and we're the eyes and ears and the basic primary caretaker of that person. Mm-hmm. We're not the caregiver because legally that's not but we are taking care of problems. So right now we are in Southern California. We have a Newport Beach office, and we have Newport Beach South, all the way to the border is our new territory.
Okay.
And so the San Diego community is one that we're in Carlsbad, California today, and we're getting involved in the San Diego community. and want the awareness. We're working with neurologists. We've done Alzheimer's screening here with Dr. Ho, and we want to expand that as well to do more screenings in the future. Actually, we are always available, 24/7. We're available by phone all the time, and we are known to get back to people quicker than anybody else that does this. And we've earned that reputation from Washington, D.C. across the country. Sunday I had a call that somebody needed me to go to a nursing home, and I went. It was pouring down rain, 70-mile-an-hour winds, and I went. It's just a calling that you want to respond as safely, of course, but as quickly, because there are crises that occur, and you have to go and just kind of dive in and see what you can do to clear things up, because it'll only get worse. So we're available by phone. We do not have office hours. People don't come into our office for treatments. Our offices are strictly for administrative purposes, but we go out into the community all the time and see multiple clients every day.
We're really excited about our app. It's called A Touch of Health, and it's a quick quiz that you can do to really get in touch with your health as a baseline to establish where you are and different areas, domains of where you can improve. We encourage you to try it once and then try to improve and see how you can do better, and then kind of progress your health and try to be the best health that you can. It looks at spirituality, wellness, medications. It's very exciting, and we challenge everybody to go out and go ahead and give it a try and to keep coming back and try to improve your score. Yeah, okay. You can do it over and over. I've done it a bunch of times. Everybody that's given it a try has really found it to be really helpful and a great tool. It's millennials up till seniors. We really feel that anybody can use it. It hits on all those things that are pertinent to everybody. Also, we don't want seniors or the older adults to be afraid of it, because it's an app. It's really easy to use. It's user friendly. You just pretty much scroll down and click. Millennials can use it for themselves, older people can use it for themselves, and also we find that sometimes the middle-aged people can use it for themselves as well. But also it's a great tool where that if you want to look and see too, what should I do with mom or dad, you can use it for somebody else. There's so many great different things that you can do with it. You just got to go to Google it and download it and give it a try and see what's right for you. There's 15 questions, and then there's 5 more that you can do as like a challenge that aren't scored. But yeah, you can get through it pretty quickly. You can save the information, so you can come back to it. If the phone rings or life gets in the way, you can come back to it. So we set it up trying to really think of it as something fun and interactive, but it's really it's educational too. So it's really everything tied up in one app. The results are 100% confidential. They only go to you, and then we give you on the results page where your health, and then you can try to improve your score, but only for yourself. You might want to think about following up with your physician, but we can't diagnose or prescribe, so it's not set up in that kind of sense. It's more for where are you in touch with your own health, and then how could you improve upon it from the test quiz sense. It's not going to be like, okay, well now you need to go ahead and change your, it's nothing clinical in that sense. Yeah. Where that we're going to tell you exactly what to do, or take this medication or that medication, or sleep more hours. It's not set up to be that type of app.